down curve that I started to circle here, this is basically your 1 to 5-year-olds. You've got a whole subsect of people that, children specifically, that have higher death than even people in their, this is the 40 to 60-year-old range, even people in their 40s to 60s, because of all of the different pediatric causes, certainly, and we'll kind of go through the specifics. This is something that I've always found interesting with this age group. So infants, some of the most common causes of death are SIDS, and SIDS is basically kind of a catch-all term for, we really don't know why they passed, and one of these, when I saw a case like this recently, it was a 6-month-old that was in bed with mom and dad. So, this is where the safe to sleep is one of the biggest causes of SIDS. Again, it's a kind of catch-all term. Unfortunately, a lot of these SIDS cases are just pure suffocation because mom and dad, rolled on them in the middle of the night and thought they were lighter sleepers, and they specifically were. Congenital anomalies is a big portion of young deaths, especially in the first year of life. Certainly birth complications and things associated with that. We got a lot of STARS kids that have to do with the birth. And then, of course, the accidental suffocation, strangulation, keep bags and small items away from children. Recognizing non-accidental traumas. And then, of course, the biggest thing is the airway management. That's why I put this picture of the little pediatric patient at the very bottom. Knowing our airway managements, especially the 0 to 5, but 0 to 1, the most common cause of death is actually respiratory, not cardiac, of course. So moving on to the age group 1 to 4, some of the most common causes are really the accidental injuries, the suburban swimming pools, the accidentally got into chemicals underneath the sink, poisonings, motor vehicle accidents, especially if they're not wearing their, car seats, and that kind of stuff is a huge part. Again, the congenital anomalies is a piece of the puzzle. And of course, abuse cases can be in there as well. So making sure to focus on your pediatric assessment triangle. Certainly scene safety, especially if you're suspicious. These are the cases, make sure you document how everything looks, how everything smells. I can say I know as an experienced provider, you just kind of know when something doesn't feel right or smell right, that kind of stuff. So, and of course, remember your pediatric protocols. As we move along into the 5 to 14 years, motor vehicle accidents starts becoming more common. Once you get a little bit more size and girth, especially as a pediatric patient, knowing, the parents, it's nice when you get a kid that's a little bit bigger and has a little bit more reserve to them. Usually the viruses and things like that of the early age, that, the RSV and stuff, stop being quite as important. Cancers, pediatric cancer is still a thing. Hopefully AI and technology and stuff will start to take care of that stuff. And then, with social media and cell phones and that kind of stuff, suicides has become increasing over the last number of years. They just recently came out with a study a couple of weeks ago that basically showed any kid that has a phone under the age of 14, their increased chance of suicide, increased chance of depression, anxiety, and all that kind of stuff. And a lot of it's tied to the social media. So, it's tough in these days. It's a tough time to be a parent, because even when you put parental locks and child locks, these kids are smarter than we are. They'll figure a way kind of around that stuff. So, our focus, obviously, if you've got school-related emergencies, behavior-related emergencies, in your trauma protocols. Then once you get into the young adults, of course, especially the young male adults, most common deaths are your motor vehicle accidents. You do have the suicides and homicides start to leak into there. These are times, and as much as I'm a big gun advocate, make sure you lock up your guns. That's a significant especially in terms of the homicides, but even the suicides, that's a significant portion of it. So, make sure you teach kids about gun management and gun safety. And sometimes guns are just not for every kid. There's certain kids that don't have the bandwidth or the mental capacity to kind of understand the implications of having them. And this is coming from somebody who owns at least 8 or 9. So, and hunts. So, but make sure you practice, good gun responsibility. And it's certainly a risk factor that I asked mental health patients every time we talk. Whenever I get a kid that comes in that's altered, even a young adult, the high, you have high index of suspicion for drugs and alcohol, that are chemicals. Unfortunately, a lot of the stuff, especially things under the sink or the things they may get into, may not pop up on our testing and whatnot. But that's a very common cause of this kind of stuff. Once we move into the 25 to 45-year-old 44-year-old range, again, unintentional injuries, motor vehicle accidents is still pretty high. This is where the genetics start to come in. The heart disease, suicides is still a part of it. Certainly, remember using your Narcan when you think that's a piece of the puzzle, and then mental health and mental and substance abuse is certainly an important piece of the puzzle for these folks. Once you get into the 45 to 64-year-olds, it's heart disease, and then kind of some other stuff. Certainly cancers. The older we get, the more likely you are to have cancer. 44% of the Americans will at some point have cancer. That statistic actually increases to about 64% ish if you work in the fire EMS specifically. So, knowing your risk factors, make sure you wash turnout gear. Make sure you're doing all the precautions that you can on the backside, to keep yourself safe. And then, of course, unintentional injuries. And then once you get to the 65 plus, again, heart disease is the big part. That's one of the most common of all. Then certainly cancers, Alzheimer's related type diseases, dementia, falls, that kind of stuff. Certainly these are groups too that polypharmacy. These patients are on just a ton of medications, and it's hard to remember one medication when you're young. I can't imagine having 10 to 15 and multiple times a day and pill, that kind of stuff. It's difficult. It's difficult. So polypharmacy ends up being a big piece of the puzzle. So let's get on to kind of some more fun stuff here. And you got to kind of pay attention to the question. This is the deadliest animals in the United States, and this is where we start to kind of get interactive with this discussion. I want everybody, take some guesses, but you have to listen to how the question's phrased. So what is the deadliest animal in the United States? And by that, I mean, what causes the most human deaths? And I'll kind of pause for a second, let everybody type in you can type or say kind of what your results are.
Take 2 seconds and let them in.
Oh, we need to take, okay. Hang on, I'm going to pause a second and we'll.
Bites. Everybody's saying, okay, I got it. Bites is what people are saying. Dogs, mosquito. Drew says mosquito, and then Tree says dogs. Maddie says bites.
Okay.
Back to shoot.
All right. There we go.
Sharks.
Okay.
Maybe that's ultimate.
All right. So deadliest animals. Sharks is sharks is usually like one a year. Bites, not necessarily. I'm looking kind of more for specific type of animals. Mosquitoes is a really interesting answer in terms of the world. Mosquitoes is actually the most common cause of death, and that's because of malaria and other infectious type diseases. Bats is no as well. We just don't see that much tetanus. Thankfully here, or rabies rather. Thankfully here in the, in the United States, we're pretty aggressive with certain specific animals, bats, raccoons, most small rodents. We usually prophylax for rabies. We've actually not in this region, per the health department, not seen a cat or dog transmission in rabies really since like the 70s. So most bites we don't see much. We don't see much transmission. We don't even give prophylaxis. It's a whole 5-shot series too, so it's a bit of a commitment. But they typically don't recommend in those kind of situations, especially when we can, either watch the animal or if we know they're up to date with their shots and whatnot. So
Jared says spiders.
Spiders is on there, but not in the top 5. So deer is actually number 1. Usually about 120 to 220-ish people a year die from car accidents. I know personally people that have been hit, actually a couple motorcycle riders that, hit a deer and ended up dying. Of course, bees and wasps, hornets, that kind of stuff, your smaller bugs from allergic reactions. Usually dogs cause about 40 to 45-ish deaths on an annual basis. And I didn't pick a specific breed, as you can see on the picture on the side there, because really, truly, it's mostly mutts. I know certain dog breeds get kind of a bad rap, pit bulls specifically, and certainly they're up there. But the majority of deaths are truthfully just mutts. Then you kind of get into, some of your farm animals, cows, a lot of times from, trampling, kicks, falls, that kind of stuff from horses. Spiders is up there. Our spiders in this country are not that deadly, truthfully. It's usually kind of the very young and the very old. Same thing with the snakes. Our snakes here are really kind of overgrown earthworms. Again, really the very young and the very old. The vast majority of time, we really don't even give anti-venom. The reason for us to give anti-venom, if, a lot of the bites are on the ankle or the hands, if they crosses the knee, crosses the elbow, or if they start having systemic symptoms, a lot of times with these, because they're relatively rare, I admit them to the hospital, kind of overnight, just for an observation. So the teams can kind of keep an eye on their vital signs, but also watch for the symptoms. And then you've got your big animals, and these are the common ones I hear a lot: sharks, bears, alligators, that kind of stuff. Most of these are somewhere around 1 a year. That especially with if you haven't seen the 50th anniversary of the Jaws documentary, I highly recommend it. It's a lot of fun. But we've thankfully I'm also a big subscriber to Shark Week in July off the Discovery Channel, because sharks are really kind of the puppy dogs of the water, and most shark bites on humans are accidental, and most of the time they're kind of a bite and run type of thing. So very, very few shark deaths on an annual basis. So how about the deadliest drug overdoses? I know this one's near and dear to our heart here in this region.
Okay. Second.
Hang on, say it again. I had you muted. Oh, we got a couple more people we're going to put in. So send in your deadliest drug overdoses. There we go. Okay, there we go. We'll get past the. I think it's in there. I think this might just be pills.
Patrice says accidental. Maddie says fentanyl. Jared says fentanyl. Maddie says other opioids. And Drew says opioids.
Yep. You guys nailed it. Alcohol is on there. So yeah. So and these are ones I hate to say they're easy for us to pick, because these are ones that we see truthfully on the daily in this region, and it's still a massive issue. The fentanyl and the synthetic opioids is far and away the largest, but even heroin, your secondary kind of opiate, is a big cause of this kind of stuff. I was truthfully kind of surprised to see cocaine and methamphetamines as high as they were. certainly the benzos and alcohol, of course, are up there, and then lower ones, your MDMA or LSD, they're kind of party drugs and stuff. So, how about top deadliest recreational activities?
ATVs.
ATVs, I heard that one. That's on there.
Motorcycles gotta be.
Maddie says motorcycle. Gary says motorcycle.
Motorcycle is going to be big, but that's kind of lumped into
Kara says cycling.
motorcycle is kind of lumped into MVA type stuff. So I don't think that's on this list, but
Drew
certainly
says
that's high up there.
vehicles.
Vehicles for sure. That's one of the most common
Swimming.
deaths. Swimming's on there.
Jared says snow sports. Skydiving. Latrice says skydiving.
Hunting.
So swimming, drowning is one of the most common causes. There undoubtedly, there's a lot of things that I do and or don't do and or teach my kids specifically. And one of the things I was talking with all my kids do swim team, not because we're big swimmers necessarily, but my wife and I love lakes and pools and ponds and the ocean, that kind of stuff. We want to make sure our kids are proficient in swimming. So we have them do swim team to make sure they're good swimmers, truthfully. And one of the things I always think about, and I personally got caught in a riptide in Hawaii one time, is actually that it's more common for good swimmers to drown than people that are not good swimmers, because typically people will overestimate their abilities. So, and I know we've got one of the, we always pick people out of the rivers here locally of people that, you can't see the undercurrent, can't see, kind of the dangers in the muddy waters type of things. ATVs, certainly. Road biking, cycling is another thing. I truthfully, I personally do mountain biking. I feel like that's dangerous enough, but often I see people get hit by cars that are road cycling. So certainly an activity. We thankfully here in this region, we've got enough trails, the Katy Trail and a lot of other trails, that you can stay off the roads, but not an activity I truthfully become a part of. And then hiking, horseback riding, skydiving certainly are on that list as well. So how about top deadliest environmental causes in the United States? I hear heat's on there.
Snow sports, skydiving. Max says tornado.
Heat, cold,
Hypothermia. Yeah.
hypothermia.
I like Max's tornado.
I think I talk about tornadoes somewhere on here, but I can't remember if it's a slide. So, yep, you guys got it. Heat is the most common. Cold, second most common.
That's you.
And of course, floods is up there as well. So, hurricanes and tornadoes absolutely do make that list. Wildfires, of course, and I think somebody said snow sports. So landslides, avalanches is absolutely a piece of it. I was a bit surprised to see lightning strikes as one of the top things on this list too. Lightning strikes is one of my, I'm going to talk about it in an upcoming discussion in a couple of months here, where we're going to talk about some different risks for fire EMS type of thing. But one of the things we're going to talk about is kind of mass casualty incidents. Lightning strikes is one of my favorite mass casualty incidents to talk about, only in that, not that I've ever even seen one, truthfully, but only in that it's the only mass casualty incident that you actually take care of the dead people first. So typically, if you get struck by lightning, a lot of times it will throw you into VFib, VTAC. If you get struck and you're fine, you're kind of fine. If you get struck and you're dead, that's the time that you actually focus on the dead first, because a lot of times they're ones that, with good ACLS protocols, we can bring back. And that really, truthfully, that kind of goes off into just electrical injuries in general. Typically you don't, if you have an electrical injury at a house, it's not multiple people. So that's why lightning strikes ends up a lot of times being an MCI, especially if it's a stadium or whatnot. But the lightning strike, and electrical injuries. Again, take care of the dead first. I threw earthquakes on here. Earthquakes is another topic. Again, I'm working on some environmental type lectures in the months to come. It's one I definitely want to discuss. And we live on the New Madrid fault here in this region. Actually, I just saw a stat yesterday as I was looking into kind of the different things with earthquakes. The last time we had one here in the St. Louis region was like 1820s ish, 1821, something like that. But it was a 9.1, which is a significant.
Wait, did Mississippi go backwards?
Yeah,
So
Shirley said
Kara-
Mississippi go backwards.
Kara here at U City, there's an interesting book called Shattered Air about a lightning strike MCI on Yosemite's Half Dome.
Oh, cool.
But as he said, is this just United States or is this
Just United States, just United
Okay,
States. Yeah.
because we would think that earthquakes and landslides would be
Earthquakes, landslides, and tsunamis would be big ones when you're talking about kind of throughout the world. But I focused this one. I focused on kind of the United States, though. So, how about the deadliest sports in the United States? Obviously, everybody knows I'm a big sports fan. Football's on there. I don't know if they considered hunting a sport, but I see what you're saying. I've seen plenty of people that either fell out of deer stand or shot my buddy that I thought was a 10-pointer, that kind of stuff. They just saw movement in the bush.
Jared and Maddie both say football.
Football's on there.
Motorsports.
I don't remember if they included motorsports in this one, but I have to certainly motorsports. And that again, that's
Drew goes wrestling, MMA.
Pugilistic sports undoubtedly are on there. So there you go. Yep. Base jumping, of course, is extremely high. This list is based off mortality per participant type of thing. So, when we talk about base jumping, 1 in 60 fatality rate, that's obviously pretty high. Again, I think somebody nailed it. Motocross, ATV racing is high. Then you got your football, you got your mountaineering, scuba diving is up there, or skydiving. I'm surprised cheerleading was on this list, and especially higher than ice hockey. But it makes sense with certainly cheerleading. It takes an incredible amount of athleticism and whatnot. So certainly they see plenty of injuries in that realm, and then. Hockey and your pugilistic sports, your boxing, your MMA type stuff. So, how about the deadliest foods in the United States?
Peanuts.
Peanuts is on there. Peanuts and nuts in general.
Shellfish. Eggs. Broccoli. Kara's got broccoli because she doesn't want to eat it.
Broccoli only if you're like 5 years old.
Peanuts and shellfish.
Yeah, peanuts, shellfish gonna be on there for sure.
Drew also says dairy.
So the list I got this from, and this is not just cause of death right now. This is kind of cause of death all in. And I've quipped before that I think my wife's trying to kill me vis-a-vis processed meats, and she's doing a pretty good job of slowly doing it because I have a soft spot for processed meats. But of course, sugary drinks, trans fats, they really only recommend red meats a couple of times a month at most. Mostly
Okay, Dr. Raff,
fish and chicken.
This is okay. We're medics, so we want those emergent deaths. So peanuts is number one, leading cause of fatal food allergy in shellfish.
So I would agree with that. So I would agree with that peanuts, shellfish, and strawberries specifically would be your top 3 causes of anaphylaxis. So this list is kind of based off just the all in causes of death, but undoubtedly I would concur that peanuts, shellfish, and really just nuts in general, but shellfish and for some reason strawberries ends up being one of the top causes. So here's kind of an interesting one. I elicited from a couple of different groups what topics that they wanted to add, and one of the ones was unconventional U.S. deaths by annual volume, and of course, spontaneous human combustion is one of them. But This one, the guesses could be pretty wide. So I'll just give you the list right off the top. And I think about, again, there's a lot of weird things that we see in medicine, and I've seen this vending machine statistic before. I can't say that I haven't thought about this multiple times, especially when I've seen somebody pushing on a vending machine, and you can see how easily something like that's top heavy could easily fall over, then falls from bed. Autoerotic asphyxiation, if you don't know what that is, ask your mom or dad. Ladders, falls, of course, the bee stings, drownings in barrels. Well, if you haven't had the birds and the bees talk, then I don't want to have it with you. But of course, choking on food, and then spontaneous human combustion. Radiation poisoning is rare, but certainly something to keep on the front of your palate and know. Certainly in this region, we've got a lot more nuclear offall from the Manhattan Project and stuff like that. So that might be a good discussion to do later on. But low incidence right now, but could certainly be higher on our list in times to come.
Jared says, I've seen a couple of soccer goals. But that autoerotic asphyxiation, all of us have almost one a year. And it's usually in the fall or spring when school starts.
So I don't know if you heard, Shirley said everybody sees an autoerotic asphyxiation on occasion. About once a year we have one. Certainly it happens. I mean, people do some weird shit at their house. So if you're gonna do something like that, make sure you have a buddy, somebody to cut you free. How about most common line of duty deaths? This was another one that was suggested to me. So
Drew says cancer, Kara says cardiac, Jared says cardiac or heart.
Cardiac's number one, cancer's up there.
And Drew says suicide is creeping up.
Suicide is on there, unfortunately. So cardiac arrest, vehicle accidents is actually an incredibly high cause as well. Of course, structural collapse, medical illness, exposure, trauma, and then violence and mental health, the suicides, that kind of stuff. Talking about vehicle accidents, just a hot second. One of the things that we, have kind of put forth in this region is be mindful of when to use your lights and sirens. They've done studies on this type of stuff, and I realize what it is in the region in terms of people expectations and the lights and sirens and whatnot. But know that not using your lights and sirens doesn't have any effect on patient outcomes, doesn't have any effect on time to hospital. But using lights and sirens does have a higher incidence of fatalities with the patient, but also with us. So be mindful of the times when to use them and times when not to. Usually we try to shoot for like 5 to 7% of the time to be able to be using lights and sirens. So something to keep an eye on.
Jared also says training pranks.
So some kind of EMS fire safety tips, obviously make sure you rehydrate, make sure you're doing your annual cardiac screenings, limit your overexertion, wear a seatbelt, obviously. Certainly the mental health support and resilience training is a big part of it. One of the lectures, and at the end of this, I'm going to kind of shoot out to you guys. What do you guys want to hear me talk about? But one of the lectures that I'm working on right now that I think will be probably early next year, maybe January, February, will be purely based off fire EMS, wellness and health and that kind of stuff. So we're going to talk about nutrition. We're going to talk about mental health. We're going to talk about, kind of a lot of things we can do to keep ourselves safe. But I did want to put a quick plug in for the mental health protocols. I know everybody has the protocols. I know everybody probably knows about it. But this specifically is how you get to the mental health protocols on your app. As far as I know, we're the only medical direction that has a mental health protocol specifically for our providers. So if you go into your acid remap, SIMS protocol app. You go to treatment protocols, go to special response protocols section. You go to the rehabilitation mental health for responders. This is not for patients. This is for us. This is exactly what it looks like. And this is exactly what the slide, and it's got a whole bunch of different things that, a pathway that you can follow. And I can tell you that this protocol has been used many multiples of times. I know this protocol is still in the SSM protocols because I still get calls from our former SSM folks, and Shirley and I do the right thing. As you can see on the bottom left square, as you can see on the bottom kind of left square here. Gosh darn it. I'll get it. Here we go. Got it. Good. There's my number. There's Shirley's number. So we are available 365, 24/7. We have answered multiple phone calls about this. We will help. Again, we've helped multiple people that are not even under our medical direction because this is a big family, and that's the way we've always seen this. So if you are working down this protocol and you really, truly don't feel comfortable with the other answers, you don't feel comfortable with any of that stuff, call us, text us. I can tell you we are available. We have done this multiple times. I guarantee we will do it multiple times forward. One of my least favorite things to do is to sit at the kitchen table after one of our providers has taken their own life. And I've had to do it multiple times in my career. I know I'll have to do it again, but we want to do everything we can to support you guys. So just my plug for that. How about deadliest medication overdoses in the U.S.? We'll get back to it for a minute.
Pain meds, antidepressants.
Pain meds, antidepressants, absolutely.
Oxy.
Yep, absolutely. Your
Beta blockers.
Your opiates. Yep. Beta blockers is on there for sure. Let me go through the list, and I'll remind me we're talking about weight loss drugs. Obviously your opiates are up there, and you can kind of wrap in methadone with that as well. That's going to be your respiratory depressants. Same thing with your benzos. Honestly, I was kind of surprised to see gabapentin, pregabalin up there, a medication that I write a lot more than I gave credit for that it was on this list, truthfully. Tylenol is one I wanted to talk about just a hot second, only in that, a lot of people have big bottles of Tylenol at home. Truthfully, this is and I can go off on a whole dissertation on Tylenol, but the most commonly purchased, taken, given, written, and prescribed drug, and yet the efficacy of Tylenol is 44%. The efficacy of a placebo is 42%. So it's not even statistically significant over a placebo, but yet Tylenol is one that's commonly overdosed. Now, I think it's okay. I don't keep Tylenol around my house because I have 4 kids. I think it's okay to have a pediatric bottle of Tylenol. They don't put enough in the pediatric bottle, even if like a 2 or 3-year-old takes the bottle and chugs the whole thing to be an overdose. Truthfully, it's enough in the pediatric bottle. If you're an adult and you think you need a dose, that's fine. But it always makes me nervous when people have these big bottles of Tylenol, because you can buy 100 pills for like $5 and keep it, and it lasts forever. But something to be mindful about your own house. Somebody said antidepressants. That's certainly on there. Benadryl is on there. I've seen quite a few Benadryl overdoses. Most of the time, they get that anticholinergic toxidrome and sometimes seizures. Most of the time with supportive care, they get better. Clonidine, of course, is one of my least favorite antihypertensive. Not only can it cause hypotension in the overdose, but if you take it on a regular basis and don't take it, they get such bad rebound reverse hypertension. Ends up being pretty painful. And then a lot of times people will use insulin. They know kind of what they have. Remind me what you said about the weight loss drugs. Okay, I had a question about weight loss drugs. So we're not seeing a ton of overdoses specifically with the weight loss drugs right now. But I can tell you probably clinically 1 to 2 times a week, right, I see people with adverse reactions secondary to the weight loss drugs. And I've had a lot of people ask me, what do you think about Mounjaro or Ozempic or all this kind of stuff? Truthfully, my opinion on these medications has been my opinion prior. There really, truthfully, has never been proven to be a free lunch in medicine and a free lunch in terms of calorie deficit. I think eventually, especially with all the side effects that I see from these drugs, I think eventually we're going to find that There's some ill side effects, obviously short term, but I think long term as well. Now, I think some of which the mechanism of action of these drugs really just makes people less hungry, so I think the calorie deficit works from that standpoint, but it does make me nervous how often I see adverse reactions. And a lot of times these are injectables, so, and we don't, people as you guys know, the general public really doesn't. People often come in for like, well, just give me the reversal agent. We have like 4 reversal agents, and 2 of which we very, very rarely use. I had a nurse practitioner last night after I gave it, the nurse gave a patient some fentanyl and kind of snowed the patient that said, a person that's actually on hospice and chronically on fentanyl. I had a nurse practitioner that said, well, just give him Narcan. And I'm like, no, this patient's breathing. Obviously you've never given Narcan, but a hospitalist nurse practitioner that kind of recommended that's never really seen Narcan given and doesn't know the implications of, especially somebody that's on chronic, chronic opiates like that, and certainly a hospice patient. So breathing on their own, let them metabolize it.
Okay, 2-part question. So fluorescent saw 2 or 3. Pardon?
You come up here. Well, no, I know, but just make sure you're in the microphone here.
Okay. Flow Valley saw a couple of metallazine overdoses over the weekend that we emailed you about. And the cops actually went on it. It's synthetic. It's a synthetic opioid, and it's on the streets. So Flow Valley had them. And then my second part question is, our nice little Hollywood is taking beta blockers for anxiety. It's already on TikTok, and it's already coming up the I-70 corridor pretty much. And
Okay,
44.
got it. Okay, all right. So let me start with the synthetics, and then we'll talk about beta blockers, calcium channel blockers, that kind of stuff. So in terms of the synthetic opioids, we are finding often that these are resistant to Narcan specifically. And I truthfully, in my opinion, if you gave 4 total milligrams of Narcan intramuscular or IV, again, the intranasal is a bit erratic. If you gave 4 milligrams IV or intramuscular, and they didn't have a reaction to bring them back, they're not coming back. I've never seen anybody get, the 6, 8, 10, usually after I get past the 4 that I've given in the ER, we're on to the next steps. Supportive care, these are ones that a lot of times they're going to metabolize it, but unfortunately with these synthetics, a lot of these synthetics are either made for like horses and rhinos and stuff like that, but also they don't react quite like our prescribed medications work. On to the beta blockers.
Just epi and bag.
Well, the airway. Either put a nasal trumpet and bag them, or take their airway if you have to take the airway. So supportive care, and that's if they're not breathing, we got to breathe for them. So I would be aggressive on these, and a lot of times they end up intubated on ventilators for days and a week or 2 just until they can metabolize them, because some of these they just if they've got such a massive a dose, they don't metabolize very fast either. So onto the beta blocker specifically, and part of our training in the emergency department, we actually spend time with the Illinois Poison Control is what I did, but we spend time at the poison control type centers. So I was in on quite a few beta blocker and calcium channel blocker overdoses. These are scary. These are bad. There's only a handful of medications and I got a pediatric 1 pill can kill list, and both of those are on there. But these are medications that it doesn't take a whole lot for them to be deadly. And we have kind of some experimental things. We do things like we actually give incredibly high amounts of insulin. We'll give like 200 units of insulin as a bolus. And I remember having a call, from the poison control center. I'd have to call ER doctors or hospitalists and say, okay, here's what I want you to do. And they were nervous as hell, because those are not typical things that we do, in the hospitals. But usually if we marry them with a D10 drip or something like that, it kind of keeps the people safe and whatnot. But the propranolol is a common medication that is prescribed for anxiety in certain types of populations. I don't as an ER doc, I don't love it because I think there's a lot of other medications out there that are better for anxiety, truthfully. But I think that, it's something we're going to have to deal with, and unfortunately people overdose on. So, obviously the things with the beta blockers, not only they drop your blood pressure, but they can also drop your heart rate. So not as well tolerated as a lot of the other antihypertensives for that reason, but I can't help but think that dropping the heart rate is part of the reason why they want to.
Glucagon, yes.
Yeah, and certainly glucagon. You bet. So this is not really a deadly list in the United States, but this is a one pill can kill list, and I've taught all kind of students, residents, and obviously EMS in my career. I don't think I've talked about this topic with EMS specifically, but something that I think is important. You really, especially if you have kids, you got grandkids, you got nieces, nephews, anybody that's going to be around your house, and these are things that. I can tell you this has happened to me. I had my parents were staying the night at my house, and my mom takes trazodone to sleep, and my 8-year-old, who was 3, I think at the time, got into her trazodone. She was over with the youngest, waking up as a baby, and I remember waking me up hurriedly. I'm like, he got in my pills. What do I do? And I'm like, what did he take? So this is near and dear to my heart because it's happened to me. Now, I basically told her, like, okay, just watch him. If he starts acting squirrely, let me know, wake me back up. But short of that, feed him breakfast, give him, a glass of milk, and kind of see what it is. We got any guesses for one pill can kill?
Beta blockers.
Beta blockers is on there. Pain, yeah, opioids, pain pills, you bet. And I honestly, I talk about these with some of our physicians and our nurse practitioners as well, because one of the medications, I don't know if it's on this list here specifically, but one of the medications that's really truthfully commonly written for, but a lot of folks don't know it, is the Tessalon pearls. I have a whole discussion anytime somebody comes in and asks for Tessalon pearls. I ask, do they have kids? Do they have grandkids? Do they have anybody under the age of 5 that can be around these medications? Because Tessalon pearls is one that's on there. And of all of the antitussives, it's a medication that helps with cough. That's all it really does. It doesn't treat anything. Yeah, it helps with the cough, but why subject your household to something that could potentially be on there? But yep, you guys nailed it. Opioids is far and away the most common. We've seen this plenty of times, and me personally, I've seen this plenty of times. Clonidine, really any of your antihypertensives, your calcium channel blockers, your beta blockers, the sulfonylureas and the glipizide, the glyburide. These are the medications for diabetes. These ones can drop your blood sugar as an adult, but obviously certainly as a pediatric patient. Iron supplements, anything nicotine, cannabis, the Lamodal, a lot of things that people kind of have in and around the house. And of course the tricyclic antidepressants, a lot of the antidepressants will be on this list.
People typically have antimalarials in their house?
Those are the anti-malaria. The question was, do people typically have anti-malarials in their house? Those are medications that are used off-label not off-label, but for other type of disease entities, not just malaria. Yeah. We don't see those are kind of in the list of anti-malarials. We don't obviously see a whole lot of malaria in this country. We also don't see a lot of polio or measles or mumps but that may change too. But these are hydroxychloroquine specifically and chloroquine are ones that are used for other disease entities. So anywhere you are in the United States, 1-800-222-1222 will get you to the Poison Control Center. Be aggressive from the field, especially if you've got a pediatric patient or even an adult patient and you're like, hey, I'm not 100% sure what to do. I love calling them. Even if I know what to do, I will make a phone call to Poison Control. You can certainly give us a head start if you call from the field. One, I like calling just because I know the more calls they get, the more funding they get. But two, if you call and you put in the case and the number, they're already going to kind of know what's going on. They're already going to kind of have a leg up. So by the time the patient shows up to the hospital, when our nurses or even the physician, because I call often too, and say the name, they're like, oh yeah, I already got the case. Here's what it is. I can fax you the information, and they're already kind of on it. But they're yeah, they'll call the patient. They'll call the family as well. So great center, great resource that we have in the United States. But anywhere you are in the United States, 1-800-222-1222 will get you to the local poison control center.
It's in our protocols. John has a story.
Oh, thanks.
So,
Yeah, pediatric.
you got to come up here. You got to come up here.
Oh, there you go.
Quick story.
Yeah, we had a call a long time ago where a pediatric young child got into the citronella oil and drank some of the fluid of that, which immediately will present normal. Poison control said watch him for the respiratory drive. And as we were transporting, his respiratory drive stopped. We had a supportive care, kind of came back on its own. By the time we get to the hospital, they think we're making this up because he presents fine. And then next thing you know, St. Anthony's is flying him out to Children's because then it's coming back. So that's a big supportive care. And people have citronella, around the houses.
You bet. Thank you for that, John. And of course, in terms of the fatal overdoses, most of the time it's polysubstance. Most of the time it's either recreational or on purpose, of course. Often we see, and I see kids that come in, they're like, yeah, all I did was smoke marijuana, but they're laced, the medications that they take, they get off the street, the marijuana they get off the street is laced with, other stuff. I've seen any and every drug under the sun that's been laced in the marijuana, and they're usually sold as kind of, hey, this is the special ride, special trip, that kind of stuff. And it's like, well, the reason why it's special is because there's some other shit in there. So I recommend we see this daily and weekly. Truthfully, I always recommend people, marijuana's we've made it legal, and I'm actually, I don't use or indulge in marijuana, but I have been a big advocate of making it legal for two reasons. One, you can tax it, but two, to make it safe. I think that's part of the problem is when people get it off the street, we just don't know they don't know what the hell they're getting. So more importantly than anything, make it safe. So I did see this case recently, and I thought that was pretty probably one of the most American things that I've ever seen. So what's the most common causes of anaphylaxis? Here's a category for Shirley. This is the one she wanted. Shellfish, bees, wasps. You bet. Nuts. Sesame. Sesame. Yeah. You bet.
Wheat.
That's not
Tree nuts. We got anything on the list? Anybody texting in? I can't see the text list.
No, but Jared did say lisinopril.
Near and dear to your heart. Yeah. So the common stuff's the common stuff. Your food allergies, your insect envenomations, medications, latex is on there, certainly. Then there is exercise-induced anaphylaxis. Idiopathic is just kind of a catch-all term for we have no clue and we didn't figure it out type of thing. So this is another one that was suggested to me that I thought was worth mentioning because it's an interesting topic. And this specific one is not the most common causes of deaths, or no, not the most common cars that are associated with deaths. The most common, and I'll give that answer before I give this list. I wanted a list of what's the most, if car, what's the highest likelihood that you're going to be involved in a fatal car wreck. So the most common ones are, I think the top of the list was a Chevy Silverado.
Jeep.
I don't
Let them
remember.
guess a little bit.
Yeah. Okay. Well, I'll let you guess about what. So this list is the most common cause of vehicular fatalities per owner. So you own this vehicle, you're at a higher risk because the most common vehicles associated with deaths are just the most common vehicles out there. The most common vehicles, well, motorcycle far and away. This is just cars though.
Nope, this is not semis.
Not well. It can be it's not semis in the sense of the semi itself, but some of the ones on this list are because of semis.
Which car has most people die in?
Well, the cars that have the per capita is what I'm going
Right,
at.
yeah.
The cars that have the most deaths are actually Chevy Silverado is the most because it's the most common car out there. Ford F-150 is number 2 because again it's like the second most common vehicle out there. But this is a list of I own this vehicle and I'm more likely to die because I own this vehicle specifically. We got any more guesses?
EVs on it?
What is it?
Electric vehicles? With the fire
There is an electric vehicle on there. Yes. So, and I find this list interesting only in that the reason why some of these vehicles are on here are for different reasons. Your Hyundai Venue, that's because it's a small car. Your Chevy Corvette, it's because of the driver. Your Mirage, because it's a small car. Your Porsche 911, because of the driver. The Honda Hybrid, again, it's a small car. The Tesla Y, and here's your electric vehicle. And if you haven't reviewed if you haven't seen a call with an electric vehicle fire, you haven't reviewed your hydrofluoric acid protocols, now's a good reminder to do it because if you haven't seen one, I can assure you you will. I can't help but think, these Teslas are supposed to be made safer. And I'm pro green energy, but I don't think right now where we are with the electric batteries, I don't think electric vehicles is the answer to being pro green energy. Really, when you do the math on how much input it takes to make an electric vehicle, your carbon output, you'd have to drive the vehicle for like 9.5 years to bring back your carbon output. And I think those materials could be used in better ways. Solar energy is one of my favorites, but I'll get off my grandstand on that one. But again, I found this list to be interesting, especially if you own any of these vehicles. Only in that some are the vehicle itself and some are the behavior of said driver of the vehicle. So interesting list.
So Kara goes, I feel like Audis are doing some crazy shit out there.
Again, that's Audi's doing crazy shit is more kind of the vehicle owner than anything. So how about deadliest infections? Again, another one that's near and dear to my heart. These are not necessarily the bugs themselves. We'll talk about those in a second, but kind of what are the most common causes of deaths in terms of the infection itself. And anybody that knows our protocols and knows me, and I'll kind of race ahead because we're running. I want to give some time for some Q&A once we get done with this talk. But knows that sepsis is first and foremost. It's the most common death in hospital of any infection. The most common cause of sepsis are UTIs and pneumonias. The most common cause of those. E. coli in the urine. You're talking about staph and strep for the pneumonia portion of it. So causes more in-hospital deaths than heart attacks and strokes by about 10x, truthfully. So, but COVID, flu, tuberculosis, HIV are of course on there as well. I thought this was a fun one. We'll end with this one and I'll kind of open up as a Q&A. Deadliest vacation spots. And this kind of goes back to not the most people that die there, but the most people that die, percentage of people that go there.
So is that a vacation or can it be in your backyard pool?
Vacation.
Okay.
Yeah, vacation. And this is around the world too. This is not U.S.
Beaches or mountains?
Not Everest.
Mountains is on there.
Not Everest because they get like what 2 to 3.
Shirley nailed it. Mount Everest, number 1. So just kind of the different, I thought this was fun and Gary nailed, the violence crime of Mexico as being a part of the puzzle. But I thought this was kind of a fun list of the different reasons and different causes of some of the deadliest vacation spots. So
I did think beaches, yeah, because it's sharks.